you guys, Lady Rochelle here, author and founder of Warriors Talk, where we move away from awareness towards action. This is day 2 of your 31 days of breast cancer awareness fact. Last night we talked about pink washing, which is organizations slapping that pink ribbon on products, which they necessarily don't have anything to do with breast cancer awareness or even research or helping out individuals who are dealing with breast cancer. So if you missed that video, go back and press rewind and be kind. But tonight we're going to talk about family history and breast cancer. So we all have individuals in our family that we know who has been diagnosed with some form of cancer. According to statistics, 1 in 3 women, 1 in 2 men will be diagnosed with cancer in their lifetime. So your breast cancer awareness fact for tonight is 85% of breast cancer occur in women who have no family history of breast cancer. I know we have all heard people or women who have had breast cancer and they say, well, I don't know, where the breast cancer came from because nobody in my family has dealt with breast cancer. So they're trying to figure out where it came from. Well, a woman's risk of breast cancer can nearly double if she has a first-degree relative, a mother, a sister, or a daughter who has been diagnosed with breast cancer. So in my case, I've been diagnosed with breast cancer. So my daughters, I am a first-degree relative of theirs, so they would have to make sure that, they are being aware and taking action when it comes to breast cancer or any type of cancer for that matter. So the most significant risk factor for breast cancer for a woman is just simply being a woman. That's it. You're a woman and you're growing older. So normally, they would say, you would get breast cancer in, older women. That's why they have the age set for the mammograms at 75 because, it used to be where, older women would get it. You would have like sprinkle every now and then some younger women, but now younger women are getting it just, at an alarming rate as well as, the 45-year-olds. So about 5 to 10% of breast cancers can be linked to a known gene mutation inherited from either your mother or your father. So these mutations are known as BRCA1 and BRCA2 gene mutation. And what you need to know about these mutations, so it's called BRCA1 and BRCA2, which stands for, the BR stands for breast and the CA stands for cancer. The 1 is it's a different type of gene mutation. So you have 2 different proteins, which that's what they are, and they help suppress tumors. Yes, they help suppress tumors. So the BRCA1 and 2, they do carry different chromosomes. They're found in different chromosomes. So they also help repair DNA damage, which is important to, how the cells are supposed to, they live, they multiply, and then they die off, right? They're supposed to live, multiply, and then die off. But the cancer cells just keep multiplying, and they're not dying off. So that's how, the cancer cells, because of that damaged DNA, is allowed to continue to multiply the way that it does. So if you're just tuning in, we're talking about family history as it relates to breast cancer. And we're talking about the BRCA1 and BRCA2 gene, which is gene mutations that when your DNA is damaged, it can cause your cells to continue to overpopulate and can turn into cancer. So when either of these genes are altered, the mutation can mean that the protein product does not function properly. And again, the DNA is damaged and is not properly repairing itself as it should. Our body is self-healing. So when something is wrong in the body, it doesn't function properly, which means that something is wrong in the DNA. Somewhere your DNA, the genes go rogue and it starts to continue to populate or not function as it should. So these genes mutations, BRCA1 and BRCA2, can increase your risk as a female of ovarian cancer and breast cancer. And they are also associated with other risks. So as far as the BRCA1, as far as the BRCA test, there is a, they call it a genetic test that you can take to determine if you have a hereditary link for cancer. So I ended up taking a test, and when they told me about the test, like, they don't really give you, they didn't give me a lot of details. Like, I didn't know what type of test it was going to be. I thought, like, are they going to have to cut on me? What are they going to have to do? I didn't know what they were going to do. It ended up being a blood test. And the blood test took about 6 weeks to come back. I think it was like 6 to 8 weeks to come back. And that was the test, the BRCA test, that they were taking to try to find out if I had a hereditary link to breast cancer in my family. And my test results came back that there was not a hereditary link. That goes back to that 85% of individuals, of women who get breast cancer, had no family history of breast cancer. So in my case, they said, no, you don't have a history linked in your family. My doctor said, we don't know where it came from. So they had no idea. But I would suggest, if you have breast cancer in your family, or any type of cancer in your family, just talk to your doctor about getting the test done. We all know of Angelina Jolie, who is an Oscar winner. Back in 2013, she broke the news to the world that she ended up getting a double mastectomy because she tested positive for the BRCA1 gene. Her mom actually passed away from cancer. So she decided to be proactive and take some preventive measures and get the test done. And so because she was at a high risk, the doctors told her that she had an 87% chance of developing breast cancer. And so she actually tested positive for the BRCA gene, the BRCA1 gene, which is an increased risk in breast cancer. So if you found out that you had an 87% chance of getting breast cancer or any type of disease, and you had the power to do something about it, what would you do? So Angelina Jolie took it upon herself, and she got a double mastectomy, which brought her chances from 87% down to 5% chances of getting cancer. And she also had an increased risk linked to ovarian cancer as well with the BRCA1 gene mutation. And that was 50%. So she had an 87% chance of getting breast cancer and a 50% chance of getting ovarian cancer. So she decided to take a preventive measures, which you can do, and that's what we call a previvor. A previvor is someone who takes preventive measures so that they can decrease their chances or their risk of getting cancer. So from an 87% all the way down to a 5%, for breast cancer. You can't beat that. So on average, with the BRCA1 mutation, the women have up to a 72% lifetime risk of developing cancer. And for women with the BRCA2 gene mutation, you have a 69% chance. They are different. Again, one is with BRCA1 is found in the 17th chromosome, and BRCA2 is found in the 13th. I'm going ahead of myself. It's found in the 13th chromosome. So they are two different, although they kind of work similar. They are different. They kind of function the same, but they're found in different places in different chromosomes. So you have BRCA1 and you have BRCA2, but they both can be an increased risk to cancer if you test positive. So less than 15% of women who get breast cancer have a family member who has it. So that's only 15%. Remember at the beginning, 85% of women who are diagnosed with breast cancer do not have a hereditary link. Only less than 15% of women who get breast cancer has a family member. They have a family member who has it. So what is that telling you? Oh my goodness. That's telling you not to bank on, nobody in my family has cancer, so I don't have anything to worry about. No, you still continue to get your screenings at the right age, or if you find a lump, you are talking to your doctor about that lump to find out, if there's nothing to worry about. So don't just take for granted because, I don't have anybody in my family that has cancer, so I don't have to worry. You still have to worry. You still have to worry. So where are we? So BRCA1 mutation, and it increases your risk of breast, ovarian, um, pancreas, cervical, uterine, and colon cancer. That's with the BRCA1 gene. So if you test positive for that, then you have to worry about all these other cancers. Um, it's also associated with the triple negative breast cancer, which is what I was, diagnosed with, which is harder to treat and is very aggressive. With the BRCA2 gene mutation, it's an increased risk in breast, ovarian, pancreas, gallbladder, bile duct, and melanoma cancer. So again, they kind of work the same, but they're different. They're different genes that supposed to function in your body to suppress tumors, but sometimes they go rogue and something happens to your DNA that damages it, and the cells, instead of them multiplying, dividing, and dying off, they're just multiplying and not dying off, which turns it into cancer. So men with the BRCA1, BRCA2 mutation have a higher risk of developing breast, testicular, prostate, and pancreatic cancer. So men, you still have to stay on top of your health as well. You know, breast cancer is not just a woman's disease. It also affects men as well. So who should be tested for the BRCA mutation? So if you have these following, these following factors in your family, then you should be getting tested. If you have a first-degree relative, mother, sister, a daughter, someone that's a first-degree relative, then you should be getting tested. If you have someone that was diagnosed before the age of 50, you should be tested. If you have someone in your family who is a male and they were diagnosed with breast cancer, then you should be getting tested. So there are so many things that we can learn from the gene mutation, as far as if you have a family history. If you don't have a family history, then you still need to talk to your doctor about staying on top of your health, as far as the screenings that you need for the particular age that you are. You still need to talk to your family to find out what type of cancer is running in your family, to see if you need to take some type of test. Now again, I said I took the BRCA test and they told me that, oh no, you don't have a risk for an inherited risk, I should say, an inherited risk for cancer. So, you know, that put some peace in my mind, because, you know, I didn't have to worry about, okay, my daughters, you know, this being something that I can pass down to my daughters. Like, it wasn't a hereditary link, there was no family link. So it kind of gives you a peace of mind. Now, if it had been to where I tested positive for the BRCA and BRCA2, then my daughters would be, I would have to put them on alert and say, hey, you know, when you get, you know, to a certain age, if you want to take preventive measures, then you can do this. So we just have to just make sure that you're on top of whatever it is that runs in your family. You know about it. You keeping a record of it. Who had cancer? What type of cancer they have? Are they still alive? What type of treatment did they have? And just for your records, keep it for your records so that you'll know. So you'll know, and you'll have to use that as, I don't want to say as a weapon, but just put it in your toolbox, so when you go to the doctor, you can bring those things up. So if you have had cancer and you have not had the genetic test, talk to your oncologist about getting it done, so that you can, again, have that peace of mind to know that it's not a hereditary link. Because I asked my doctor, I said, so should I be getting a hysterectomy? Like, should I be worried about, you know, this cancer? You know, she was like, ovarian cancer. She was like, no, that's not, you tested negative for, you didn't test positive for the BRCA, so don't worry about it. I wouldn't get a hysterectomy. So I was like, oh, okay, you know, because it worried me. So, yeah. So, I'm hoping that I've covered them all. So just remember that a positive result, if you take the BRCA test and you get a positive result for BRCA1 and BRCA2 mutation, it doesn't mean that you're going to develop cancer, it just means that you have a higher risk than normal. So at that point, you should be talking. You should be talking to your doctor. You should be. So what did we learn? What can we take away from family history and breast cancer? Talk to your family. Start having these important conversations about health. About health. Not just with cancer, but with diabetes, with high blood pressure. With anybody having strokes, anybody having any heart disease. Start talking to your family about this. It's important. It's important because uh, it's part of your family legacy, and you could be the one to break those generational curses of getting diabetes and high blood pressure and cancer. You could be the one to do that just by keeping on top of your health and making sure that your family knows what's going on between everybody who gets something. We need to stop being ashamed about these different diseases and start opening up our mouths and sharing it with individuals so that we ultimately can live healthier, longer lives. And the ones that do get a cancer diagnosis, they can have a better quality of life by just getting a head start on their health, getting a head start on the family history. So thank you so much for tuning in to the special edition of Warriors Talk again for the next 31 days. Because it's Breast Cancer Awareness Month, I will be giving 31 facts. So all the way up into October 31st, I will give one fact a day and then elaborate on it so that you can be better, well informed when it comes to breast cancer awareness, and you're not just buying pink products and settling for that, but you are getting more knowledge that you can use and share with someone else. So share the video out with someone else so that they can get the facts as well. So thank you again. This is author and founder Lady Rochelle right here on Warriors Talk, where we are changing lives one warrior at a time. See you tomorrow.